Hello everyone. The topic of my report is preliminary findings of a national-wide multi-center database of resected PDAC patients in China. All data related today were retrieved from CPDC. So first things first, what is CPDC? CPDC is short for China Pancreas Data Center, which was established in 2017 and fully activated in 2018. CPDC is a nationwide multi-center database of resected PDAC patients. The second part is to validate the AJCC 8th edition staging system. The data of PDAC patients who met the inclusion and exclusion criteria were reviewed retrospectively, and a total of 1,686 patients were retrieved. These are the baseline characteristics of included patients. From the graph and table, we can find significant difference in prognosis between T and M stages, except for the CSS between stage 1B and 2A. Moreover, among 963 patients who were lymph node negative, the survival between each T stage was significantly different, but not between T2 and T3. And 723 patients had node-positive disease. The new classification of end stage was highly discriminative throughout the entire cohort. So these are the conclusions of my second part. And my third part is about constructing a risk grading model for predicting early recurrence. The data of PDAC patients who met the inclusion and exclusion criteria were reviewed retrospectively. A total of 3,279 curatively resected PDAC patients were retrieved. Pancreatic cancer usually correlates with early recurrence and metastasis, but there is no consensus in defining early recurrence. Based on post-recurrence survival, we found 9 months after radical resection was the optimal time interval for early recurrence among Chinese PDAC patients. And 4 preoperative variables were identified as the independent risk factors associated with early recurrence. Then an omogram was developed to include the above 4 independent preoperative predictors. Internal and external validation showed relatively good performance of the scoring system for predicting early recurrence. According to our model, 13.6% of the PDAC patients in CPDC had a possibility of relapse in 9 months at 60%. These patients may not benefit from upfront surgery. So these are the conclusions of my third part, and thank you for your time. Goodbye.